Reproductive health is a complete physical, mental and social well-being and not merely the absence of disease or infirmity in all matters related to the reproductive system, functions and processes. Due to diverse cultural and economic content, it has become difficult for some families to educate their young ones about sexuality, a situation an advocacy officer of the Sexual, Reproductive and Health Rights Alliance describes as a contributory factor to the increasing numbers of challenges faced by young people in the country.
Open discussion of sexual reproductive health issue is very much limited or even absent in most communities. Young people, because they are young, would like to experiment. So the counseling, the guidance, and the necessary coaching that has to be given to them, if it's not ripe and at the right time, they will miss it. Even health service providers, they like the youth-friendly service provision.
Country lead for Access Services Knowledge, Ask Ghana, Doreen Thomisen says, sex education in Ghana is always not comprehensive, making it difficult for young people to have access to it.
This campaign about comprehensive sexuality education is very important because there's still a lot of young people in Ghana who do not fully understand their own bodies. Comprehensive sexuality education is key. It's very important. Sexuality information in Ghana, unfortunately, is not always very comprehensive. Not all the issues that young people want and need to know about are included.
A member of the National Governing Board for Ask Alliance, Al-Hassan Mohammed Awal, called on government to intensify comprehensive sex education in schools.
The state will take the additional responsibility of ensuring that all teachers are trained and have adequate information on sexuality education, so that even teachers in those rural communities would be able to reach out to young people in those areas. In fact, parents have a key role to play, because if the school is providing sexuality education and then parents expressing some kind of anger at home, denial at home, then we will not be having it holistically.
In Ghana, a lot of young people do not have access to comprehensive sex education in schools, and sexually transmitted infections are still difficult subjects in most rural communities. As a result, teenage pregnancies, HIV, STIs, and unsafe abortions are still on the rise.